1,963 new cases reported since yesterday, 1,168 people in the hospital, and sadly, 12,480 people who've died. Our prayers continue to be with those who've lost friends and loved ones and those who are fighting COVID-19. We continue to make progress turning the corner on this pandemic. Our COVID-19 trends remain relatively stable, although we have seen slight increases over the past couple of weeks. The fact that our numbers aren't yet declining reminds us of how important it is to stay vigilant in our fight against this virus. North Carolina's strong safety protocols and actions to slow the spread are why we've been able to avoid a surge in cases overwhelming our hospitals. And our careful, reasoned approach has worked, striking the right balance. Numbers released from the CDC and the Bureau of Labor Statistics show that North Carolina is among the states with the fewest deaths and fewest job losses per capita. We put health and safety first, but we've worked with businesses and health professionals to get it right. Now I want us to look forward and see where we can be as spring turns into summer. First, when it comes to the vaccines, we want to make sure that at least 2/3 of adults have at least one shot as quickly as possible. With at least 2/3 of adults vaccinated, our public health experts believe we'll have enough protection across our communities to be able to live more safely with this virus and to begin to put the pandemic behind us. We now have an adequate supply of vaccines, so we need everybody to step up. As we work on vaccinations, we need to keep our COVID trends, such as cases and hospitalizations, stable. And we need to keep being careful and responsible to keep those trends down and save lives. I believe we can. With increasing vaccination rates and ongoing work to slow the spread of the virus, I anticipate that we will be able to lift all mandatory social distancing, capacity, and mass gathering restrictions by June the 1st. And I plan to issue an executive order next week outlining safety restrictions for the month of May. Being able to make progress is good news for North Carolina. And here's how we can keep doing it. We will continue to distribute vaccines in a way that's fast and fair, and we won't let up. As of today, almost half of adults have had at least one shot, and more than 1/3 are fully vaccinated. And for our more vulnerable age 65 and older population, almost 77% have had at least one shot, and more than 71% are fully vaccinated. That's great news. But we must keep going strong. And in a moment, Secretary of Health and Human Services Dr. Mandy Cohen will talk about a campaign we're rolling out to get more people vaccinated. Although we're making progress, we haven't beaten COVID-19 yet. And the virus will still be with us even after June the 1st. So we need to keep being responsible. We need to keep wearing masks. We need to get more people vaccinated. And we need businesses to keep paying attention to current executive orders and future health recommendations. With eligibility now open to all adults and appointments easily available close to your home, we urge everyone ages 16 and older to make sure they take the time now to go and get a shot. The vaccine is safe and effective and free for everyone. There are many same-day appointments and walk-ins allowed. They are easy and everywhere. Vaccines are the key to us moving forward, to strengthening our economy, to making sure our children are on track for school now and in the fall, to hugging our loved ones safely, and to saving lives. Each shot in an arm is a step closer to putting this pandemic in the rearview mirror. North Carolinians have shown up for each other throughout this entire pandemic, and we need to keep that commitment by getting our vaccines. And if you've already gotten your shot, help your neighbors and friends and loved ones to get vaccinated. And if you have questions about where to get vaccinated, go to myspot.nc.gov to learn more. In the meantime, we're continuing to monitor the data and the trends, both here and in other states. What we see there and across the world with the new variants is a cause for concern. Let's not become one of those states that's seeing a sharp increase. We all know what we need to do to move beyond this. Wear our masks, be responsible, use good judgment, get vaccinated. We're so close. And together we'll get through this and come out even stronger on the other side. At this time, I'll recognize Dr. Cohen to share an update.
Thank you, Governor. As the Governor shared, if we work together, getting everyone vaccinated and keeping our metrics in a good place, we can bring back summer to North Carolina. We are making good progress. Our trends are largely stable. Our early warning surveillance system, who shows people who come to the emergency department with COVID-like symptoms, continues to be stable and low. Our cases are stable, though the percent of our tests that are positive has inched up a bit and is now a bit over 5%. Our hospitalizations are slightly up over the last few weeks, but hospitals have capacity. We also continue to vaccinate people quickly. As the Governor said, almost half of North Carolinians 18 and older are vaccinated with at least one dose, and the vast majority of those at highest risk for serious illness from COVID have been vaccinated. More than 70% of adults 65 and older are fully vaccinated. That's amazing. As we look forward to lifting most requirements in June, I will note that masks will still be important, and safety protocols will still be recommended in certain settings. First, children under 16 are not currently able to get vaccinated, so there will be ongoing safety recommendations for places like camps and summer school to protect our children against COVID-19. Likewise, in high-risk settings, such as large venues that bring a lot of people together indoors, there'll be ongoing safety recommendations. And while June 1st is our first goal, if we keep working and can get to at least 2/3 of North Carolinian adults having at least one shot, and we keep our trends stable, we could be able to go even further and lift the mask mandate and lighten other public health recommendations. But we've got work to do. Half of North Carolinian adults are still completely unvaccinated, putting them at higher risk of contracting and spreading the virus. To help us reach our goal of having at least 2/3 of adults with at least one shot, we are launching a Bringing Summer Back, Get Out the Vaccine campaign. The campaign creates a space for organizations and individuals to roll up their sleeves and do their part to stop the spread of COVID-19. It will run during 2 weeks in May and 2 weeks in June, during which organizations across the state will rally together to promote vaccination. There are lots of ways for groups to get involved, including organizing volunteer days, handing out resources, and helping to schedule appointments. There are ways for individuals to help too, so go to yourspotyourshot.nc.gov to learn more. If we can get to at least 2/3 of North Carolina's adults vaccinated, we can get back to the summer activities we all love, like backyard gatherings with family and friends, public fireworks, outdoor festivals, or parades, all without wearing masks outside. I know my daughters want summer back, and so do I. However, until enough of us are protected by the vaccine, we need to keep protecting each other. I want to share our new video reminding us that we aren't done just yet.
To every North Carolinian doing the work to keep us moving forward, thank you. You put on a mask to slow the spread and protect those around you. You found creative ways to stay connected to family and friends. You lent a helping hand to a neighbor in need. Let's keep it up because we're not done just yet. Until enough of us are protected by the vaccine, we need to keep protecting each other.
For now, keep wearing your mask in public so we keep our trends where we want them. That also means getting tested for COVID-19. Anyone with symptoms, fever or cough, even if you've been vaccinated, should get a test. And if you haven't gotten your shot yet and have been exposed to COVID, you need a test. We are at an exciting moment. We now have enough vaccine for everyone. Supply is strong and stable. It's widely available, and in most places you don't need to wait or have an appointment. If you are 16 and older, and it is your turn to join the more than 3.6 million North Carolinians who have already taken their first shot. It's up to you to get us to that 2/3 goal and beyond as quickly as possible so we can live with this virus and begin to put this pandemic behind us. You have a spot. Take your shot. Thank you, Governor.
Thank you, Dr. Cohen. Also with me today is our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Our sign language interpreters are Monica McGee and Mark Lineberger, and Jackie Mativier and Erica Kugler are our Spanish language interpreters. We'll now take questions from the media. If you can state your name and your organization, we'd appreciate it, and we'll take the first one.
Our first question is from Ashley Talley with WRAL.
Thanks for taking my question. Just to clarify, June 1st is when you plan to lift capacity and most distancing things, but no changes to the mask mandate at that point, correct? And is there a target date when that could be lifted?
So first, we're going to continue to have a mask mandate through May, and we will be announcing exactly what kind of mask mandate that is next week. After June 1st, we hope that that mask mandate would only be required for people in public places indoors, is what we aim for. And Dr. Cohen is talking about that when we get to 2/3 of people who have been vaccinated with at least one shot, then we may be able to lift all mask mandates at that point in time. So that's where we are, realizing that we have a situation across the country and the world where a virus and its variants are still strong. But the fact that we've gotten so many people vaccinated, we're finding these vaccinations to be safe and effective in keeping people from getting this virus and really keeping people from getting seriously ill and dying, we feel like we're in good shape. Until then, we've got to still continue to make sure we're careful and responsible. Would you want to amplify that any? Okay, great, thanks. Next question, please.
Follow-up, Ashley Talley, WRAL.
I think you just made a lot of people really happy with that announcement. I know that everybody is looking forward to getting back to normal. I just had a quick follow-up question about two programs that the state has to help the unemployed and those who have been unemployed. We're still getting a lot of complaints about unemployment and people not getting checks, and also the HOPE rental assistance program. There's $500 million in there. Why haven't applications reopened there, and how do you think unemployment is improving?
Well, for one, we know how hard it is for people who are unemployed, and it's critical that we get this money to families so that they can pay their rent, put food on the table, and survive until they can get a job. We provided $11.2 billion to almost a million North Carolinians. We know that the appeals process has been difficult for a lot of people, but because of that, the state has tripled the number of people who are handling appeals since the beginning of the pandemic. There have been about 90,000 appeals so far during the pandemic. About 69% of those appeals have been handled, and they're working really hard to try to handle the rest of them as quickly as possible. For the HOPE program, we've been able to provide millions of dollars to thousands of people to make sure that their rent is paid and that the lights are kept on. And the good thing about the HOPE program is that the money goes directly to landlords and directly to utilities, and once an agreement is signed, utilities can't be turned off and people can't be evicted. Changes were made to the law by the General Assembly, and the HOPE program, NCORE, which is handling the North Carolina Office of Recovery and Resilience, has been working to put the program back in place with the new changes of the legislature. Also, with this new money, there are new federal requirements which they're still going through. So they hope that applications can reopen as quickly as possible, because we need to get help to people as quickly as possible. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. I have a question for each of you. Governor Cooper, when you saw the Vice President on Monday, did you talk about any potential future role in her administration? Would you be interested in one? And for Dr. Cohen, with looking at the mask mandate, and if this is lifted, is that going to be just outdoors on June 1st with the 2/3? And what about children under 16 who aren't vaccinated? Will there be a factor with masks in schools?
The Vice President and I talked mostly about the pandemic and the response, and she talked about how well North Carolina had done, and I appreciated what the Biden-Harris administration had done to give us a steady, strong supply of vaccines to get people vaccinated. We also talked a lot about the new jobs that are coming into our state, and the fact that people need post-secondary, they need some education after high school, and that's one of the reasons why we met at Greensboro Technical Community College. We talked about clean energy because we went over to Thomas Built Buses, where they're building electric buses that a lot of our cities are using, and that school buses will be used with electric buses. And we know this clean energy economy is going to attract a lot of jobs to our state, and we need to take advantage of that. That's about all we talked about. I'll let Dr. Cohen answer her question.
Hi, Dawn. Just to clarify a couple things on the timeline. So I think our first goal is to get to June 1st with our trends continuing to be stable and our vaccination rates increasing. And if we get to June 1st and those two things are happening, then we anticipate that we can lift most of the executive order related restrictions. As the governor said, we would keep a mask mandate as we moved into June, as we still work towards our goal of getting at least 2/3 of adults having at least one vaccine. So we do anticipate that reaching that goal will take us longer into June, but I would say this is where North Carolinians really need to roll up their sleeves, literally, and help us get to that goal. And once we are able to get to that goal, we can further ease mask mandates and other public health guidance. I will say, as you mentioned in your question, that those under the age of 16, as you know, are not able to get vaccinated right now. They are, it is not eligible for them to get vaccinated. And so in settings that are focused on children, we know we'll have to have ongoing safety recommendations for those settings, as well as in those highest risk settings, places like large venues that we've talked about many times that can be places where this virus spreads more easily. Those will also need to have some ongoing safety recommendations. But I think what you're seeing is lay out this plan as we move from spring into summer, as we keep vaccinating, that we continue to use that dimmer switch approach. We can continue to lighten these restrictions as we continue to make progress. But we have work to do ahead of us. That's why we're launching the Bring Back Summer campaign and that Get Out the Vaccine effort, and we're going to need all hands on deck to make that happen. Thanks.
Next question.
Follow-up, Dawn Vaughn, News and Observer.
Hi, thanks for the follow-up. Governor, you said that's about all we talked about, but you didn't answer if you'd be interested in a role in any future or current administration with Biden or Harris. And Dr. Cohen, do you still think that children should wear masks beyond when they're recommended for adults?
I'm concerned about serving as governor for the next 3.5+ years and making sure we do a good job getting through this pandemic. Dr. Cohen.
Hi, Hi, Dawn. We do anticipate wanting to make sure that our kids remain safe until they are able to also be eligible for vaccine. So we do anticipate additional safety protocols in settings where it is focused on children, like schools, like camps. And so we do expect masks to be a portion of those safety protocols. Thank you.
Next question, please.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Thanks for the time and the question. Governor, I had a question for you just on juvenile justice court proceedings. We know kids as young as 6 can have to appear in court. There's currently a bill that would raise that age to 10. Do you support that proposal, and would you rather see it raised to 12 or an older age?
Wrong to have kids that young in court. We need to raise the age. I look forward to working with the legislature to make sure that we get this right. It is critical to make sure that our juvenile justice system is doing the things that we want it to do to help turn kids around that are in trouble, to help them through the process. So I look forward to working with them on making sure we get this right. Next question, please.
Follow-up, Brian Anderson, Associated Press.
And just following up, did you want to see that raised even higher to 12 years old? But also just a logistical question for you. When can we expect in-person news conferences, and are you switching them from weekly to biweekly?
Well, first, on the